Thank you for joining us today. Today's topic is going to be family awareness. And we are very happy to have with us this afternoon Mr. Eric Geyer. He is from Cleveland Clinic, and he's going to be speaking to us on the program that he managed for children that are dealing with ADHD. So, Mr. Geyer?
Yeah, no, thank you very much for the introduction, and really happy to have the opportunity to meet with you all this afternoon. So as Ms. Santiago said, I'm going to be talking about some programs that we offer for children diagnosed with ADHD, that's attention deficit hyperactivity disorder, with the main focus being the summer treatment program, which I have the privilege of being the director of here at Cleveland Clinic. So I'm going to first introduce myself briefly, and then I'll pull up a PowerPoint that has some different information as we go along during my presentation today. As was mentioned, I work at Cleveland Clinic Children's, and I'm a counselor, a licensed professional counselor in our ADHD and Learning Center. In that role, I work with kids and families for individual outpatient counseling or therapy, as well as group therapy. So some of the different groups that we offer, both social and behavioral skills groups, and then the summer treatment program, which I'll be talking more about. And I've had been in my role with the ADHD Center, or in a role with the ADHD Center, going back until about 2014. Have been the director of the summer treatment program going back to 2016, and then have been in a counseling position, an outpatient therapist position since 2019. So just a little bit about my background, and then I will pull up my screen share to share some slides as I talk about the summer treatment program today. All right. So it looks like the screen shared, at least from what I can see on my end. So again, I'm part of Cleveland Clinic Children's ADHD and Learning Center. Just to introduce a bit, I know I shared about myself. Some of the other members of our team includes Dr. Michael Manos. So he's the head of our ADHD and Learning Center and a child psychologist. Dr. Hallie Fetterman, who's a licensed psychologist as well as a board certified behavior analyst. So the two psychologists on our ADHD team, as well as two psychology assistants, my colleagues, Nicole Mahoney and Megan Dickinson. And then sort of connected to our ADHD center is a learning evaluation clinic. So I won't be speaking specifically about learning evaluation, the learning evaluation clinic today, but we have two wonderful psychologists who do comprehensive learning evaluations if kids are having difficulty in school and you're not, parents aren't certain what may be occurring. So that's just a bit of our staff, the larger center at Cleveland Clinic Children's. And then before I get into the summer treatment program, which you'll see highlighted here at the end, just a note to give folks some information on current services that are offered through our ADHD and Learning Center. So one includes an evaluation clinic. So if a family's not certain, if their child may have a diagnosis of ADHD, we're not certain what's occurring, but they're noticing, some symptoms and pieces in a school setting, that can be a resource to participate in a comprehensive evaluation for ADHD. Certainly the first step for families, though, that I would recommend is going to your primary care physician who has the ability to diagnose ADHD or could refer for a more comprehensive evaluation. Our center also offers a medication monitoring clinic, which is in collaboration with pediatrics at Cleveland Clinic. So this is a controlled trial of medication treatment for ADHD. So I'm not a medical provider per se. I'm not a licensed MD, so I don't provide medication advice or medical advice in that way. But medication is certainly an evidence-based intervention for children who have a diagnosis of ADHD, and the medication monitoring clinic, which our center partners with pediatrics on, is a controlled way to take a look at what medications might be most effective for a child, at what dose, taking into account side effects and different pieces as well. Our center also offers individual therapy and consultation for children diagnosed with ADHD, as well as different group therapies. So often these are behaviorally based interventions or skills training. So we offer social and behavioral skills groups, which include a child and parent component, another social skills group, which is a cooperative play group. It's a Lego-based group as well, that's facilitated by my colleague, Dr. Fetterman. We'll be having a Saturday treatment program, which will be similar to the summer treatment program that I'm talking about, but you might call it summer treatment program light that Dr. Fetterman is starting up that we hope to be able to be offered throughout the school year. And then the summer treatment program for ADHD, which is what I'll be talking more about today. Just a quick sidestep. So, I know that, folks may be more or less familiar with what I mean when I say ADHD or attention deficit hyperactivity disorder. So just thought I'd put in a quick couple slides on symptoms for ADHD. So I won't spend a great amount of detail on this slide, but when we're looking at ADHD, for an individual to receive a diagnosis of ADHD, there's certain symptoms that would be present. So ADHD includes one group of symptoms, which are symptoms of inattention, things like being easily distracted, forgetful in daily activities, failing to give close attention to details. And when we're looking for an ADHD diagnosis, we'd be looking for 6 or more of these symptoms in this category being present across 2 or more settings, and in a way that is intrusive to a person, or in this case, a child's functioning. So a person with ADHD may have symptoms of inattention that are present, as well as symptoms of hyperactivity and impulsivity. So things like talking excessively, difficulty sitting or remaining seated, running about or climbing in situations that aren't appropriate. So those, again, symptoms of hyperactivity and impulsivity, where a clinician would be looking for 6 or more of these symptoms being present in 2 or more settings and in a way that it interferes with functioning. And certainly also taking into account a child's, developmental level, so where they're at, in terms of their age and what's appropriate in development. So just some background if folks are interested on what those symptoms are for attention deficit hyperactivity disorder, and then depending on, a child's symptom presentation or adult symptom presentation, an individual could receive a diagnosis of ADHD, predominantly inattentive presentation. That's what was formerly known as ADD, if you're familiar with that terminology. An individual could be diagnosed with ADHD, predominantly hyperactive impulsive presentation, meaning they don't have those symptoms of inattention, but do have the symptoms of hyperactivity, impulsivity, or more commonly a combined presentation, meaning both symptoms of inattention and hyperactivity, impulsivity are present. And then there's also some other qualifier diagnoses as well for ADHD. So that's just to give a little bit of a background in terms of what makes up a diagnosis of ADHD, just very briefly, and what those diagnoses are. And the, again, program that we offer that I'll be talking about, the summer treatment program, is specific for children who have a diagnosis of ADHD and a primary diagnosis of ADHD, meaning, the primary goals for intervention, the primary sources of the challenges that may be showing up are related to that diagnosis of ADHD. All right, so the summer treatment program, or the STP, as I'll call it for short, is a program that we offer here at Cleveland Clinic Children's, but it's not something that we developed. It's not something that's proprietary to us at Cleveland Clinic. It is a standalone evidence-based intervention for ADHD. So it was developed as a treatment model going back to the 1980s by a psychologist, Dr. William Pelham, and his team. So Dr. Pelham developed and designed the summer treatment program along with his team, conducted a good deal of research to establish that it was an effective intervention, to continue to grow the program. And then Dr. Manos, who's the head of our ADHD and Learning Center, as I mentioned, initiated a summer treatment program here at Cleveland Clinic Children's in 1999. So we've had a site and run a summer treatment program every summer going back to 1999 here in Cleveland, with the exception of 2020, when unfortunately we had to cancel with the COVID pandemic. So the summer treatment program as an intervention is something that's supported by decades of research as a comprehensive and evidence-based treatment for ADHD. Dr. Manos is fond of, calling it the Rolls-Royce of behavioral interventions for ADHD. It's something that's been well researched. So I note here the multimodal treatment study, which is just for reference, one of the widest and largest studies of ADHD treatment that's been conducted to date. The summer treatment program has been adapted also into a few different versions over the years. So a summer treatment program for adolescents, which we do offer that at our site here at Cleveland Clinic Children's. There's an ST pre-K program, which unfortunately we don't offer here in Cleveland, but some sites do offer it. So for example, Florida International University, which is the home site of Dr. Pelham's team. And Dr. Pelham, unfortunately, has since passed away. And then, after school programs as well. So current clinical sites There are several across the United States. We're fortunate to have two here in Ohio. So we have a site here at Cleveland Clinic. There's one at Cincinnati Children's. And then there's some other sites across the country as well. So the Child Mind Institute in New York, Florida International University down near Miami. There's a site, I believe, in Seattle, Kansas City. So a few across the country, but fewer that hold to the true clinical rigor of the program as we do here at our Cleveland Clinic site. All right, so what are the goals of the summer treatment program? What is it aiming to support for a child who may have a diagnosis of ADHD? So the summer treatment program has 6 specific treatment goals that it lays out in the manualized treatment, so the structured program. So one is to support a child to develop problem-solving skills and social skills, so to be able to respond to whatever challenges may arise and move through those in effective ways, and then social skills and working on kids' ability to work together and get along with peers, to establish peer relationships, and to work together and get along effectively with adults. So whether that be their parents or their teachers, whatever adults may be in their world. Improving a child's ability to perform in academic settings. So the summer treatment program is not an academic intervention, meaning that it's not tutoring. It's not meant to improve a child's specific learning outcomes or that content, but it is meant to improve a child's ability to perform in academic settings. So working on behaviors that are associated with success in an academic setting. So that may include, for example, for some of our younger kiddos, working on staying in their seat appropriately, paying attention to detail when they're completing a worksheet, and making sure that all items are completed. For our older participants who are adolescents, skills like organization, taking notes during a classroom presentation. So working on skills and behaviors that contribute to success in the classroom setting. Developing a child's ability to follow through with instructions, complete tasks, and comply with adult commands. So an area that's a common goal for kids with ADHD, and those incompletions often can be a challenge that shows up related to ADHD. Developing a child's competencies to improve functioning. So really, building skills, also building on a child's strengths to improve their functioning in the setting. So the SCP does, work on challenging behaviors, provide corrective feedback, but I do have, here 3 to 1 as a reminder for myself. So it's also a place where we're intending to, build on a child's strength, really reinforce all the areas they're being effective and support a child's self-efficacy. So that's a piece of coaching that we give our staff, for example. For every 1 piece of corrective feedback, that we give a child, we want to have had 3 interactions where we're praising something that they're doing well or having a positive interaction. Teaching parents how to develop, reinforce, and maintain positive changes. So there is a parent group component to the program, as well as parents being involved every day at pickup and talking about children's goals. So a goal is not simply that a child comes to the program and suddenly their behaviors changed, but really it's also giving parents tools to help continue to work on goals to support behavior change, as much or as little as a child achieves in the sense of their behavioral goals during the summer. Our intention is that that progress can continue to be sustained long after the child is done participating. And in some cases, kids are working on goals over time. They're long-term goals that they're moving towards, not something that we would expect to be accomplished within 7 weeks together. And then the last piece, which is an optional arm of the program, is evaluating medication effects. So there's a couple programs built within the program to help evaluate medication effects for a child if a parent selects it. So medication, again, being another evidence-based intervention for ADHD. All right, so what does a typical day look like? So I've talked a bit about the program. So the summer treatment program was designed and is intended to be experienced as treatment. So it's evidence-based behavioral treatment, but delivered in a summer camp setting. So for the kids, it's meant to be experienced as a summer camp. Often they'll call it STP. So the children's program, which is children ages 6 to 12 years old, have a structured schedule that they go throughout the course of the day. So every day starts with a morning discussion, really setting the tone for the day. What's the social skill that we're working on? What are different group awards? So there's recognizing different kiddos for their progress and efforts the previous day. There's 2 1-hour recreational periods. So we play sports like basketball, softball, soccer. One of those periods is what's called the skill drill. So it's a chance for kids to learn and practice skills, for whatever sport we're playing that day. Great chance again to practice following instructions, sustaining attention, during an exercise or a drill, building peer interactions, and then a game period where, if we did a skill drill, we practice some skills for basketball in the morning, then we play a basketball game in the afternoon. There's a social skills period, so working again on specific skills for building interpersonal effectiveness. So maybe things like communication or responding to teasing. This year as well, our clinical director, Dr. Fetterman, also introduced a curriculum which is known as zones of regulation. So really working in a structured way with the youngest age groups on emotion regulation, identifying emotions, managing emotions in healthy and effective ways. There's a learning center, which is a classroom setting where, again, kids are working on those different skills associated with success in the classroom, and have individualized goals. And they're working on content at whatever grade level, an individual child may be at when they come into the summer, a lunch period, and then a creative corner, a life skills period. So it's other, enrichment activities that you might find in a summer camp setting, which we introduce both for the content for kids to, experience that content, as well as have another setting to practice those behaviors and goals that we're working on during the summer. And then an end of the day discussion. So, groups again meeting to talk about, what progress did we make, what problems occurred, what skills did we work on. And then at the end of the day, each child meets with their parent and their primary counselor. So a primary contact within or caregiver within their age group to review a child's individual progress on their behavioral goals, and what's called their daily report card. So each child has about 4 individual goals that they're working on throughout the course of the treatment day. We also serve adolescents, so 13 and 14-year-olds. They have a similar structure to their day, in the sense of the timing and the kinds of activities that they do. So it's again meant to be a summer camp-like setting, but things that show up a little bit differently for the adolescents. So in addition to recreational periods, as would show up in the children's program, they have a social skills group, also an issues group. So it's something more open-ended that gives adolescents a space to talk about whatever issues may be relevant to that group of adolescents. So it's things like interpersonal relationships or managing their diagnosis of ADHD. They have a jobs period, so it's a time where they have an individual role at the program to contribute, to practice some independent functioning skills as well. So it may be, being a sports assistant with one of the younger children's group, or it may be, working on a camp newspaper. And then they have 2 one-hour learning centers. So they have one section which is called skills and strategies, where they're working on learning, things like how do I take notes? What are different strategies for that? Or how do I keep track of assignments? And then a lecture period, a more traditional classroom period where they apply those strategies and get a chance to practice them. And then they also have a business meeting, which is really a group fundraising project. So a chance where they get to, work together on different goals that they may have as a group. So they're working to plan a field trip at the end of the summer, and they have to design fundraising projects to, raise the money for that. So that's a bit about what a typical day looks like. I won't go into great detail on this, but the behavioral principles in the program, so I won't, again, get overly technical with that, but the program works as a token economy system. So, kids receive immediate behavioral feedback. That's often a part of effective intervention for ADHD, is creating a really feedback-rich environment, supporting kids, self-awareness, bringing their attention to behaviors as you're working through that. So they receive immediate behavioral feedback, and kids are earning and losing points throughout the day, depending on, what their behavior is. So for the, quote unquote, positive behaviors, you might say behaviors that are effective for, working together with peers and adults in the group setting. Behaviors we want to start seeing more of, they earn points for those behaviors. That's things like, following directions, or contributing to a group discussion, sharing, relevant on-task idea, or, helping a peer or a counselor in the group. And then for behaviors that are the quote unquote negative behaviors, or the behaviors that tend to be ineffective, for working together with peers and adults, the things we'd like to see the kiddos, stop doing or do less of, they lose points for those behaviors. So things like, interruption, blurting out in a group, or, talking over someone in a conversation, teasing a peer or talking back to an adult. Kids would lose points for those behaviors, and then throughout the course of the day, they're earning points, losing points. That adds up throughout the week. And then at the end of the week, as part of the token economy, they can redeem those points at the point store for specific, rewards. It could be tangible objects, privileges, but things that are motivating for them to work towards. Just to note as well, I do see a couple comments that have come through in the chat. I'll aim to speak to questions at the end of the presentation, just it's for my own attention and keeping it divided. So I appreciate the questions, and please know I will get to those once I finish up the slide part of it. Another intervention at the summer treatment program is a daily report card. So this is a standalone effective intervention for ADHD. So something that was developed to be implemented in a school setting. So if you have a child with ADHD and they're having difficulty in a school setting, sometimes a daily report card can be a very effective intervention to introduce. In the summer treatment program, we use it as a way to both teach that intervention and hand that off to parents, as well as it's where a child works on their individualized behavior goals. So they have goals that are individual to them, both in what that behavior is. So I may be working on, say, interrupting less, whereas a peer may be working on teasing less. And it's individualized in the sense of what my specific goal is. So I may be working on interrupting less, and my goal is to have 10 or less interruptions per day. Whereas a peer in the group may be working on having 6 or less interruptions per day, or 16 or less interruptions per day. So it's about meeting a child where they're at with their baseline, and achieving progress from there, making steps forward. So we aim for about a 10 to 20% improvement every week. The program involves a lot of rewards and positive reinforcement. So behaviorally speaking, positive reinforcement, and then encourages the behavior to show up again. So it includes daily individual and group rewards that kids are working towards, weekly individual and group rewards. So every kiddo is working to earn Fun Friday at the end of the week, which has a lot of fun activities, sometimes offsite field trips. So it's really exciting, motivating day, and adds that incentive to work on those behavioral goals that can be challenging. They may not come naturally to that child. It may take a lot of effort to work on things that are associated with their diagnosis. We also use a timeout procedure for specific behaviors. There's behavior analysis baked in. So as I mentioned, my colleague, Dr. Fetterman, who's our clinical director, is a board certified behavior analyst. So, we'll also, take a look at specific behaviors as they arise in the program, or if we know there's a behavior coming in, and create individual behavior plans for participants. And then social learning is a component of it. So it is a group intervention. So kids are also learning from their peers, the behaviors they observe, the feedback their peers are getting, the behaviors their counselors are modeling. So it's a very rich environment for learning in that way. So the recreational activities, just an image borrowed there of what a softball game may look like. So the sports activities are, yes, about the enjoyment in playing sports, but they do serve a purpose in a clinical sense as well. So it's an opportunity to work on social skills and adult supervised organized sports, a chance to reinforce skills like on-task behavior, good sportsmanship, following the rules of the sport, which means paying attention to my own behavior and the expected behaviors in that context. It includes pre-activity and post-activity discussions. So with that goal that I mentioned back at the start of supporting problem-solving skills, it's about a pre-activity discussion. So, how can we use the social skill today? What are the rules for softball? What are ways we can apply the skills we practice in the morning? So thinking ahead, and the post-activity discussion, reflecting back, how did I use the social skill? What progress did I make? What problems occurred? So it's in a sense a lot of repetition of think ahead, reflect back, which can help to support really cultivating a problem-solving mindset, right? So continually think ahead, reflect back as the kiddos are going through their day. And then another goal is generalization. So, soccer, as we play at STP, or softball, is the same as played in the community. So when the setting can be the same, it can often help, more easily support generalizing social skills and other behaviors. The social skills component, which I mentioned, so it looks a little bit different depending on age group, but each group has a different skill that they focus on each day. And then they also have portions throughout the day where they're working on activities to teach and build those social skills. So it's facilitated by their lead counselor, maybe working on things like communication, making and keeping friends, interrupting appropriately, responding to teasing. But a benefit of the program is it's not just a skills training session where their lead counselor talks about that skill and they do 30 minutes of an activity to practice it. That feedback is really baked in throughout the day. So in the moment, when kids are interacting with their peers, when they're on the soccer field, when they're eating lunch, it's a chance to give feedback, whether it's praise and positive feedback or constructive feedback on a skill that a child's working on. It's a really wonderful opportunity. It has a lot of, again, feedback, social coaching built in, which helps make that, social skills component and all the behavioral pieces, more effective than other modes of intervention, you might say. And then the adolescent program is similar, with one difference being that it involves a lot more opportunity for adolescents to identify their own goals. So the independence and moving towards independence being a function of adolescence, it gives an opportunity for the adolescents to think about how do I want to be seen by others? What are my own individual social goals that I'm working on, and working within that setting to come up with specific goals within that area, what they can do to move towards those and receive feedback on whatever may be individually important, to that adolescent. I've talked a little bit about problem solving, so something that can occur, individually or as a group discussion. It just has the 4 basic steps of problem solving there. So identify problem, brainstorm possible solutions, choose the best, evaluate the effectiveness. And just an aside, when we look at problem solving as an intervention, so something that I came across in research, really it's that second step of brainstorming possible solutions, which is the piece, the most important or most effective part of problem solving. So it's not about, can I pick the best solution? And often, kids can say the things that, we would say might be the quote unquote best solution. So if someone's, teasing me, the best solution may be, tell a teacher or, tell them to stop, right? Those are generally solutions that we would give kids coaching on. But what happens when that doesn't work? I tell my teacher and the child keeps teasing me. They just do it a little bit more, slyly and under the radar, or I tell them to stop and they keep, teasing me in that situation. So with problem solving, we really want to brainstorm as many possible solutions and stay in action until we find that thing that works to solve the problem. So another, area of coaching and, focus of the summer treatment program. This is meant to be just a slide on data collection. So another aspect of the program is that we do, track specific behaviors throughout the course of the summer. So both positive, pro-social behaviors, as well as the, quote unquote negative behaviors, as the manual calls them. So we track those behaviors. We have data that shows a child's behavior, both their daily average frequency. So this is a graph for interruption. How many times did, say Eric interrupt on a given day? But we can break it down to parts of the day too, to 15-minute intervals. So taking a look at how behavior is showing up and then looking at behavior change over the course of the summer. So this would be meant to be an example of what we would look for, right? So there's certainly variability. Every day is a little bit different, but the general trend is, in this case, the child's interruptions decreasing over the course of the summer. And then this would be a stop behavior goal, something we'd like to see a child stop doing or do less of. This would be an example of a start behavior goal, right? Contributing to a group discussion. So, participating, sharing a relevant on-topic, on-task idea, and we'd like to see that increase over the course of the summer. So an example, of a child's progress over the course of the summer with that goal. And then I mentioned as well, teaching parents is an aspect of the program. So there are parent and caregiver coaching sessions. Those meet once per week during the 7 weeks of the summer, which I'll talk about the format of the program in a moment, and also once per month for booster sessions throughout the school year. And these parent sessions are meant to teach parents basic behavioral principles that can serve as building blocks for continued progress after the program. Really encouraging discussion, exploring the context of what it means to be a parent, what it means to be a parent, in today's world where there's certainly a lot of different, challenges that parents face as opposed to, 20 or 30 years ago. Promoting the development of a growth mindset. So staying, in action, moving towards, meaningful goals that you have as a family. And then identifying and acting towards your values as a parent. So, it's not our place to impose, values on what, should be your family values, but to create a context in which, as a parent or caregiver, you can explore what are those values, what are meaningful to me and to our family, that we want to, work towards as a family and with our child. Parents also report, so it's not the intention of the program, but an additional benefit being support, right? Meeting with other parents who can relate to, challenges they may be facing or whatever it may be. And these parent and caregiver sessions we do conduct by Zoom, something we started during the pandemic and then continued as they seem to, work that way and also encourage or assist with parent attendance relative to when we were in person. So just some of the details for the summer treatment program at Cleveland Clinic. That's just larger information that I talked about in terms of the background of the program. So details for the program. So it meets 7 weeks during the summer. So 2025, tentatively, the 7 weeks will be June 16th through August 1st. The kids are on site with us from 9 to 4:30 p.m. each day while they're participating. The location. So we do host the program not in a hospital clinical setting, but on a college campus. So we've been fortunate to have John Carroll University, which is over in University Heights, be our site for the previous 2 summers. And they've been, really wonderful hosts and ensuring that we have all the facilities we need so that, kids can play basketball games and play soccer and be outside. So we're really grateful for John Carroll's partnership where we host the program. As of 2024, so in terms of the number of participants that we accept, so I would expect it'll likely be consistent in 2025. Though certainly over time, we are always looking for how we can grow and serve more kids and families. So as of 2024, we had 6 total age groups within the 6 to 14-year-old age range. So the youngest kiddos being 6 and 7 years old, who are going into 1st or 2nd grade, and the oldest being generally 13 and 14-year-olds who are going into say 8th or 9th grade. And then we have about 10 to 12 children per age group, which means certainly we end up with often a wait list each summer or rolling over into the next year, just by nature of the limited space that we're able to offer each summer. The cost of the program, so often an unfortunate limitation of the program, and something that we keep working on with attempting to work with community resources and philanthropy at Cleveland Clinic, is that the program is not currently billable through health insurance. So it is self-pay costs, which is $5,400. So certainly something that is a limitation, a barrier to many families in the Cleveland area. So we do have some supports and financial assistance options that are available to families. So we do have needs-based scholarships that are offered through our program and supported through Cleveland Clinic Philanthropy. So this past summer, for example, we were able to offer 6 full tuition scholarships to participants, which we're really grateful for the donors who made that possible for those families this summer. And then there's also other financial assistance options in the area, depending on a child's eligibility. So we've had families receive funding through NEON to support a child's participation in the summer treatment program. Some children who are served under an individualized education plan at their school may be eligible for extended school year services. Children who have been adopted are able to receive support through the post-adoption special subsidy services, which is currently managed by Ohio Can. Cleveland Clinic employees who have the employee health plan receive some coverage as an agreement that we have with them. So it's, unfortunately a patchwork of options, but there are financial supports that are available to help families be able to participate. And then who would you be working with if you were working with us? So just a bit of the team. So again, I'm the program director. I manage things like the application process, interviewing our staff, working the summer staff training, working alongside our clinical director, Dr. Fetterman. We also have other staff who work with us. So my colleague, Jeff Jack, who's a licensed professional clinical counselor who facilitates the parent and caregiver group. My colleagues, Nikki and Megan, who help manage a lot of the, staff supervision and day-to-day functioning of the program. And then during the summer, each age group has a team of undergraduate and graduate counselors who work with the children. So there's 6 student counselors in each age group. So these are students who have applied for and are completing a competitive internship with Cleveland Clinic. Typically students who are majoring in things like psychology or education and working towards, in some cases, advanced degrees. So each group has one graduate lead counselor, either a graduate student in counseling or psychology, or a student who has significant experience with the program, and then 5 undergraduate group counselors who are undergraduate students, again, completing that competitive internship. They receive pretty extensive training heading into the program. So the manual that they're meant to review before the start of training, and then we have a full 2 weeks dedicated to staff training, and then they're supervised by our clinical team throughout the course of the summer. Okay. How would a family apply? So if you are interested, it is application-based enrollment. So it's not needing a clinical referral necessarily or anything like that. We have families who are referred by school providers, by their physician, by behavioral health providers like counselors or psychologists, other providers in healthcare. So maybe they're working with an occupational therapist, or are self-referred. They just find us online and apply for the program. In terms of the application process, we open it each year at the start of January. So the first step is submitting an application request form that holds a family's place in their child's age group until we have a chance to receive all the materials and review the application to ensure that that child would be an appropriate fit. For the application, then families would complete questionnaires via a secure online portal. Our clinical teams, myself, Dr. Fetterman, our team reviews the information that we receive, schedules an intake interview in person, so a chance to, again, meet with parents, meet with your child as well, to ensure ultimately that the program is the best fit, given the investment of time and resources that we know this summer is. We want to make sure that we can confidently say as best as we're able that we think the program would be a beneficial fit and an appropriate fit for a child. And then after that, families are informed of their acceptance, or if we don't think the program's an appropriate fit, a referral for what we do think would be the best course of treatment moving forward for a child. That may be often if a child has additional diagnoses in addition to ADHD. So whether that's something like an autism spectrum disorder or anxiety disorder, that really may be the primary source of a child's concerns. And again, possible limitations that I tend to notice or that can show up for families are, again, clinical appropriateness. We want to make sure that the program's an appropriate fit clinically for that child. And, again, children who have dual diagnosis may or may not be an appropriate fit. So why we have that intake process. The enrollment cap. So again, we have between about 65 and 68 spaces in the summer. So certainly not enough to serve the entire Cleveland area. Though the need is certainly there with an ADHD, the cost, and then the location. So we only have the location on the east side, which we acknowledge sometimes can be a challenge for folks who may be coming from west side or south of Cleveland. So where can you find additional information? So I do have just included here the websites for our ADHD and Learning Center. So easiest way to find the summer treatment program, clevelandclinic.org/STP, as well as the link to our ADHD center on the website. I also included a link for just pediatric behavioral health. So our ADHD and Learning Center is, a subset, a portion of pediatric behavioral health at Cleveland Clinic. We also have psychologists, counselors, social workers who serve, other, general behavioral health care concerns or diagnoses like anxiety, depression. So the link is there to our general pediatric behavioral health website. And then I also included a link to the Summer and Beyond directory. So it's something that the Cuyahoga County Board of Developmental Disabilities puts together each year. And it's really a wonderful comprehensive directory of other therapeutic summer camps in the area. So the summer treatment program would be an example of a therapeutic summer camp. And then there's other camps in the area, often for, other specific diagnoses, things like autism spectrum disorder, other concerns. So it's a nice resource if you're looking for therapeutic summer resources. Okay, so I will turn it over to questions and comments. Just a last slide before I do that. I also included in here my contact information. So I'll leave this slide up. I'm not sure if the slides would be distributed, but if you're coming across a recording of this, it has my contact information. So please feel free to reach out if you're looking for information about the summer treatment program or other treatment services at our ADHD and Learning Center. I'm more than happy to be a resource to offer information on those programs to help get you connected in some way. So I have my email and my direct line as well. I will make a quick note though. So my contact information is really intended for those, non-urgent questions or more information-seeking questions about the programs. So if you do have more clinical questions or concerns, I would direct you to please consult your child's physician, or if they have a behavioral health provider like a counselor or psychologist, or to call to schedule an appointment with a provider. So that you have a chance to have a full, appointment with someone and someone who can address those concerns. And then I also have, it was just a really wonderful resource with behavioral health in general, the 988 Lifeline. So, just a general piece that I think is always helpful to have as a contact if, you or your child is experiencing a mental health crisis or related safety concerns. So something like, active suicidal ideation, you can call or text that 988 Suicide and Crisis Lifeline anytime. And there's resources and support for folks. So the 988 line is a really wonderful resource to have. Or, certainly you could go to the nearest emergency room if there were a safety concern. But again, wanted to share my contact information if you're looking to, apply for the summer treatment program or, have some more specific questions about the program or additional information. So I will stop my screen share there. I appreciate everyone's attention throughout my slides. I'm first going to take a quick check of the chat to respond to those questions. So one piece I saw, what is involved in finding out when a child has ADHD? Can ADHD contribute to a variety of health problems? So in terms of finding out when a child has ADHD, often it's something that really those symptoms may start to become noticeable and get in the way for a child. So school age can often be the first times that those symptoms become, really noticeable. And then to diagnose ADHD, so typically if it were in a physician's office, for example, they would provide some questionnaires that a parent completes, and then typically also a teacher or someone in another setting to take a look at what symptoms are showing up in those settings, how's it interfering with functioning. Again, a physician can diagnose ADHD. They can certainly do that in that kind of appointment with a primary care physician, or in a more comprehensive evaluation. We would have a more in-depth clinical interview with parents and caregivers, typically gather some further detail on questionnaires, and also meet individual with a child, do some cognitive testing and pieces like that. And then the question, can ADHD contribute to a variety of health problems? So certainly, I would say there can be health problems that show up, I guess I might say tangential to ADHD, but and I don't know if this is directly a health problem, but there's a lot of research that looks at, for example, ADHD and driving, and individuals with ADHD having maybe more adverse driving outcomes, or ADHD, which can show up. ADHD in childhood, or when ADHD is undiagnosed or untreated, can lead to other diagnoses showing up secondary to ADHD in young adulthood or adulthood, things like anxiety or depression. Sometimes individuals with ADHD can have other concerns that show up as well, related to those symptoms of inattention and impulsivity. So I'm not aware of something that sort of biologically connects in that way, but certainly the symptoms can contribute to some of those health concerns. And there are other diagnoses that can show up commonly alongside ADHD. Was that helpful for your first question?
Yes, thank you.
Okay, yeah, thank you. A second question, so I appreciate the question, is, do children diagnosed with ADHD grow out of this, or does it last over the course of their lifespan? So I'll speak to our best understanding and current research of ADHD. So generally speaking, ADHD is what's known as a neurodevelopmental diagnosis. It is something that is expected to be present across the lifespan. So it's a difference in the way that the brain develops over time, and it's generally understood that a diagnosis of ADHD remains present across the lifespan. Though it's helpful to notice that symptoms can change over the course of a lifespan. So, for example, research shows that symptoms of hyperactivity and impulsivity tend to reduce from childhood into towards adulthood. So those symptoms tend to be less noticeable. They may change the way they present, but those symptoms can tend to be less noticeable over time. Whereas symptoms of inattention, research shows, tend to stay pretty stable across the lifespan. So, inattention, when a child has, symptoms of inattention in childhood, those can tend to stay present, through adolescence, young adulthood, and into adulthood. But again, with, symptoms for ADHD, when, an individual has effective treatment, whether that's medication treatment, behavioral intervention, when a child has that treatment, early on, and continues those pieces over time, symptom presentation can change, and symptoms can, go in remission, meaning we would still expect that diagnosis of ADHD is valid for that individual, but the symptoms aren't showing up in a way where they're, getting in the way of that person's functioning. So those symptoms can be in remission. Was that helpful for your question?
Yes.
Okay. Yeah, and thank you very much for asking it. A next question, where does the camp take place? So again, we host it at John Carroll University, currently, which is over in University Heights, Ohio. The cost for the camp, again, is $5,400. Unfortunately, it's not covered by insurance. I don't go into the details in terms of just challenges with health insurance, but again, there are those other financial assistance options. So needs-based scholarships that we offer through our program at Cleveland Clinic, and then some of the other community supports as well. And was that helpful for your question?
Yes, it was. It was answered. Thank you.
Yeah, thank you very much. A next piece. So what about medication? Does a child receive medication by your agency? So I'll note that medication is an evidence-based intervention for ADHD, something that's often managed by a child's primary care physician, but can also be managed if a child has a psychiatrist, so a physician who specializes in psychiatric medication. So children, for example, who I meet with at Cleveland Clinic, there are a good amount of the children I work with who also receive medication treatment. However, in our ADHD center specifically, we don't prescribe medication or manage the medication. So, we're psychologists, counselors, social workers, so we're not licensed medical providers in that way. But those children will be working with their, for example, primary care physician who prescribes the medication and manages medication for that child. In the summer treatment program, again, there are children who participate in the program who are receiving medication and who continue their medication throughout the summer. We have participants who don't receive medication and they're just participating in, behavioral interventions and pieces like that. And then children who may be participating in a medication trial, so helping to determine, if medication is appropriate and what medication, may be appropriate for that child. So was that helpful with your question on medication?
It did. Thank you so much. Yeah.
Awesome. Yeah, thank you very much. And then, a last question I see in the chat, how long is the program? Are children able to return each year until the age of 14? So the program is 7 weeks during the summer, and then, Mondays through Fridays during those 7 weeks. And then in terms of returning, children are eligible to return each summer. So, it's something that we have had some participants who, participate for 2 summers, 3 summers, even some participants who've, participated, really almost the whole age span of the program, 6 to 14. Certainly there's a variety of factors that determines, if that's something that's workable for a family, if it's an appropriate fit. So, we would take a look each year to make sure that, we felt like the program, if a child was looking to return, that it did, contribute in a positive way the year before. If, the goals that a family has right now, are currently something that we can forward in the program. So we have, a good percentage of participants who participate 1 year and then continue on with other, supports, working with their, child's physician, their, other medical team, you might say. Some participants who, again, return for another year, sometimes 3 or 4 summers to keep working on goals. Or in some cases, a child who maybe participates when they're 6 or 7, they work on the goals that, fit for them then, and then, come back later in their development. So when they're, 11, 12, 13, and then, new challenges are presenting and new goals are there. So, families are eligible to return in that way. And was that helpful with your question?
Yes.
Yeah, thank you. And see my contact information again, got placed into the chat. And then, so that I think covers all the questions in the chat. Any other, questions that folks on the line have that I can help with this afternoon?
I guess you did such an amazing job that you covered all the material. So thank you, Eric.